Hi, my name is Bob Kraus and I'm running for the United States Senate. Today I'd like to talk to you about health care reform. It's probably the hottest topic in American politics today, and it's the hottest topic because Congress is planning to do something about it. There is a bill before Congress today to create a new system to ensure that we have health care coverage for as many people as possible in this country. And why do we need it? Because there's 47 million people today that do not have health care insurance. That's 1 in every 6 Americans that gets their health care benefit by paying for it out of pocket or by going into an emergency room if they have something catastrophic, perhaps at the after their illnesses have gotten significantly worse, or they do nothing about it and they actually die at home. And there are a number of Americans that do that in Iowa. I think it's about 400 to 500 a year. And so what we're trying to do is we're trying to create this new system. And how that system is constructed makes a big difference into how many people are serviced by this new system and what kind of benefits, what kind of coverage is given. So the trick is to keep the costs down. How do you keep the costs down? One option is what we call the public provider option. In other words, besides your insurance companies out there, you have the option of picking a public provider. A public provider is someone like Medicare, Medicaid, a Veterans Administration healthcare system, or perhaps a new entity that would be the payer and the provider for the health care. This would be instead of a private insurance company. The private insurance companies would still be there. You would have the option, but you would also have the option of going to a public provider. And that public provider is there to reduce costs. A public provider such as Medicare today has an overhead of only about 2%, whereas private insurance companies have an overhead of about 15% to 20%, a few maybe as high as 30%, but it's a low-cost way to deliver a lot of healthcare service. Having a low-cost baseline service such as public health care is a way to keep these costs down and expand the amount of coverage with that money that would otherwise go to overhead. And also, when we create this public provider, we want a public provider that can negotiate on all health care costs. One of the big problems that we have in health care today is that Senator Charles Grassley, when he was chair of the Senate Finance Committee, adjusted how we pay the cost of drugs under what we call the so-called Part D Medicare plan. And in that, Senator Grassley denied the U.S. government the right to negotiate prices on prescription drugs. This costs the United States government tremendously, and it's one of the reasons for the escalating costs of health care insurance today. We need health care reform that will give you, your friends, your loved ones, people that have less than we do, the opportunity and the right to have health care insurance, to be guaranteed that if they have a severe illness, that they don't just die, that they get health care. And I think that's really important, and I hope that Iowans and Americans also think that. I hope that you will vote for me because I will work for that kind of health care insurance. Unfortunately, Senator Grassley, my opponent, is for a purely private health care insurance structure that packs the cost structure towards the private sector and also towards big profits for drug companies. Please vote for me in November 2010. Thank you. This is Bob Kraus, wishing you a wonderful day.